Hi, welcome back. I'm Beth Claxton. I'm a medical doctor, board certified in obstetrics and gynecology and certified in functional medicine through the Institute for Functional Medicine. And today I have with me Carol Petersen. Carol's an accomplished compounding pharmacist with decades of experience helping patients improve their quality of life through bioidentical hormone replacement therapy. She graduated from the University of Wisconsin School of Pharmacy and is a certified nutritional practitioner. Her passion to optimize health and commitment to compounding is evident in her involvement with organizations, including the International College of Integrated Medicine and the American College of Apothecaries, the Academy of Anti-Aging Medicine, also known as A4M, American Pharmacists Association, and the Alliance for Pharmacy Compounding. She was also the founder and first chair for the Compounding Special Interest Group with the American Pharmacists Association. She chairs the Integrated Medicine Consortium, an umbrella group for complementary medicine organizations, and she co-hosts a radio program, Take Charge of Your Health, in the greater New York area. She is on the medical advisory boards for the Center for Menstrual and Ovulation Research and the Institute for Bioidentical Medicine. She also writes and edits for A4M's website and is a co-producer of Immortality Now podcast. She offers personal consultations at www.thewellnessbydesignproject.com. Welcome, Carol.
Thank you, Dr. Beth. It's my pleasure to be here.
And I'd like to take this just a few minutes to talk about progesterone. And from you, I have learned that higher doses can really help alleviate symptoms that women have. And as we increase dosages, many women complain of fatigue. And I know that you've said that some women just don't tolerate progesterone. And I happen to be one of those. I was taking 50 milligrams a day and really felt like I was dragging myself through life. And not until I changed to topical, where I can take 200 to 300 easily, am I noticing relief?
That is one of the techniques. I started my career in this bioidentical field at Women's International Pharmacy, and we were compounding progesterone in oil capsules. And the most common at the time was 100 milligrams per capsule. And we would start women with severe PMS at 100 milligrams 4 times a day, separate doses. It was a long time, and I'm talking about years, before we had enough women remark on drowsiness, dizziness, to even put a warning sticker on the bottle. Mm-hmm. And when women did have these issues, we would ask them to change the dosage form. Instead of oral, we'd go to topical with a cream or gel, vaginal, rectal, even sublingual with drops or troche lozenge stuck on it, mm-hmm. to avoid some of that.
Mm-hmm. And did it work?
Yes, some of the time. Mm-hmm. But curiously enough, I just had somebody just comment the cream made her drowsy, but the capsules did not. And I don't know how to handle that. We believe that it's because one of the metabolites of progesterone is allopregnenolone. Mm-hmm. And allopregnenolone is very brain active and very active at the GABA receptors, and is taught to be strong as a phenobarbital would be, like knock you right out. Mm-hmm. So it's not surprising that if that's happening, that could be an issue. I did see a study way back when, 10 women, oral progesterone, 9 had no problem at all. The 10th had this drowsiness, grogginess. It wasn't, after all my years, over 30 years doing this, just recently, I took 250 milligram capsules right first thing in the morning and was shortly in that state that you're talking about, like practically drunk. And I had a workout, and then I ate a big breakfast, and it passed. So maybe that's a little hint you can use. I don't know if it would work for everybody. So changing the dosage form exactly like you did to avoid some of this allopregnanolone. And the other thing might be the amount that you use at one time. We like to prescribe progesterone to take it at bedtime because of so many women have reported this now as progesterone gets used more and more. And if you say take 200, 300 milligrams, but take it at bedtime, you don't really care if that allopregnanolone knocks you out. Progesterone can help you sleep anyway. It doesn't have to be through the allopregnanolone. It can quiet your mind and help you sleep, but you don't need the knockout effect. The trouble with the knockout effect is some women complain that they still feel that way in the morning. They haven't quite metabolized that out. So I would suggest alternative dosage forms, maybe smaller dosage forms, like smaller amounts at a time, although your daily total of progesterone might be higher, but taking 100 milligrams at a time in spaced doses, rather than trying to put all your progesterone in one dose at night, may be another technique. So that's what we've been doing with some success. Dr. Jerry Lynn Pryor, who's researched progesterone a lot, told me when I asked her about this effect. So she's seen it, and she said, well, my thought is that women are so sleep deprived for so many years that when they can finally relax, they can't get out of it until they make up their sleep deficit. And that's a true thing too. You actually can create a sleep deficit if you look at sleep studies, that women and men who are chronically deprived with sleep will at some point have to sleep, and they can't stop themselves from sleeping. But if you add a little progesterone, maybe this is happening. I've also heard that you can have that for a while, but it will wear off.
Yeah, I actually had the same thing, similar thing happen to me when I was starting to learn meditation. And I remember asking my teacher, and as a meditation teacher, I see the same thing in students. Finally starting to slow down, the body starts to slow down. And I remember sleeping so much, 8, maybe 10 hours a day, and thinking, is this ever going to stop? I was just chronically fatigued.
Yep.
My body was getting caught up to the point that it got better eventually.
Yeah, I believe that could happen. So I guess in the short term, I'd recommend lower doses each time. Do different dosage forms to see if one way or another is more easily tolerated for you, and work with that. I also am a fan of using multiple different kinds of dosage forms of progesterone. They each have their unique biochemistry, if you will, how they're intaken and metabolized and whatnot. And there's some pros and cons for each dosage form. But I like women to have options, you have capsules at certain times of the day, use creams and gels during the morning, or a lozenge, or use vaginal at night, because otherwise it's just going to fall out. Just all sorts of opportunities. I was so amazed because one of the Facebook groups had this suggestion so that you can get over-the-counter creams of progesterone, and they wanted to use it vaginally. And somebody said, I get a gummy tray and put my cream in there and freeze it, and then I can use it vaginally. And this works like a charm. I go, how clever. It really is something that would work just fine for many women.
Made her own suppositories.
Yep.
A little gummy bear progesterone.
Yep. I'm just stunned by the ingenuity and simplicity of it.
Right, right. And it's so beautiful to hear that women are finding their way,
Yes,
being empowered.
I know. And some Facebook pages and the ones I'm gotten involved in really do help women, and their practitioners have no idea that what they proposed was a failure. And what's being taught in some groups, and I think even your functional medicine group, because I've been to some of those, this start slow, start low, go slow. It's
Right.
absolutely the worst advice for progesterone. I think it's okay for the other hormones, but progesterone is so much needed and so volatile. It's very, very bad advice. And I know you can avoid a lot of the problems just by jumping right up to a higher dose, and you don't experience that discomfort at all.
Yeah, I want to interject here that I see it too in my practice. People don't want to bother me with their symptoms.
Yeah.
I have a portal just for that. Tell me if something isn't working and we will work it out. I do not want people to suffer, and they don't need to. If they should call their physician or practitioner, and if it's not working for them and if they're not getting a response, then they can deal with that bit of
Yeah.
information.
Yeah, it's so important. And I think right at the get-go, it's important for that conversation to happen. I often say to women, don't settle.
Yeah.
Because we're sort of taught this way in conventional medicine, saying, oh, you have to take this drug for the rest of your life, and oh, you have side effects, so you have to put up with it. This is like pounded into our being, that you have to put up with it. When you take the hormones in amounts adequate for you, you're going to be happy as a clam. You're going to be 100%. And so let's say you started using progesterone and your sleep improved, but it's not every day that it's improved.
Right.
Maybe that's a time to check in with your practitioner and say, oh, I've been sleeping really well, except on the weekend, I really had a problem. That allows you to have the extra conversation, like what happened on the weekend? Oh, my kid broke his arm and we spent the weekend in the hospital.
Yeah, whatever. Or
Okay.
a glass of wine.
Right. Or a glass of wine and your estrogen went up. You can't in your regular visit cover everything that somebody should really know. And it's taken me decades to learn the things I know. And I've been spending those decades really submerged in this a lot. It takes time to learn these things, and practitioners and their patients need to have that interaction. I noticed when I offer to coach somebody, I offer a 3-month coaching. And the first month is really intensive. And they like to, some of them really like to shoot me a little email or a text and say, this is happening, this is happening. And I actually get so alarmed. After a bit of this, I'll say, okay, that you do this. And I'll call them up and I'll say, goodness, what's going on? And it turns out that most of the time they're doing much better. But they hit a little snag and they're uncertain. And that's when they need to check in.
Mm-hmm.
And after that, they learn and they're in charge of their own body and know they can be, and they're more intuitive because they allow themselves to be intuitive.
Mm-hmm.
And before, they couldn't even consider this as a possibility.
Exactly. Exactly. Yep. Giving women their power back. Because we are intuitive beings, we're mothers, we have maternal intuition, and we have turned that over. We've relinquished that for sure.
Yeah, very sad. Can I say a few words about progesterone and bleeding?
Please, yes.
Because I'd like to write a blog and I haven't yet. So somebody's been without progesterone and they're menopausal or something and want to start on bioidentical hormones, and they're prescribed some estrogen, progesterone, testosterone, and they start bleeding. and it's a shock to them, and it's a shock to their practitioner who doesn't know any better either. Like, what's happening? And the practitioner gets involved. They're like obligated to rule out any kind of cancer, and people know that, and it's a fearful thing. Yet, what progesterone does, and this is kind of interesting, two different functions in the luteal phase when ovarian produced progesterone goes high. The first part of the luteal phase, it's like helping build up the endometrium further and stabilizing it for an implanted egg. Midway, no egg comes. Progesterone then has another function. It makes that tissue secretory, so you can shed it. So you're using progesterone for the first time, and you haven't had periods or very sporadic periods. You start using progesterone, and in a few days you're bleeding. Well, you thought you were done with that. Well, you are done with that. You're done with the ovulation, but you had tissue built up in your endometrium, and now progesterone is helping you get rid of it. That's a wonderful thing. I had so many calls over the years with women bleeding and they're scared. And I said, oh, that's wonderful. And they're just taken aback. Like, what's wonderful about this? I'm supposed to be in menopause. I haven't had a period in 10 months.
Yeah. Things start waking up and responding.
Yes, and it really is a very good thing to shed that built up endometrium. And it could be heavy, it could be clotty, it could be dark blood, just sitting there, not really doing you any good. So it's good to get rid of it. Then there's a situation when women are using menopausally, again, static dosing, using some estrogen, progesterone, testosterone, going along just fine. And they start spotting. Again, oh no, something's wrong. And I actually had this happen to me like once. And this is like maybe 6 years past my last last cycle and using hormones all the time. Well, I know what it is. So I always ask, did you have some additional stress in the last couple months? And sure enough, and sometimes it's some really big ones. So during that time that you have stress, progesterone helps augment your production of cortisol so you can cope with that stress. But now you leave your endometrium unprotected. You've got all this estrogen stimulus coming along, and you're going to build up a little layer. So when the stress passes, progesterone's again coming back to its progesterone balancing activity for estrogen, you're going to get rid of that tissue you built up. So it's actually the resolution. Now, if this keeps happening, you're a little unstable, and you ought to decrease estrogen or increase progesterone, one or the other, a combination thereof, to give yourself a little more leeway to handle stress. But you're fine.
Yeah.
So
actually, do have a patient who said she felt better when, and I don't know how she knew to do this, when she took like 100 extra progesterone during times of stress, or
yes.
before these long distance races that she did, she would take extra progesterone and it helped her feel better. And that's exactly why she was supporting the extra cortisol production in her body.
100%, 100%. If you're going on vacation, extra progesterone, because you're out of your normal routine, everything's a little bit extra challenge. So help yourself in advance. Then you won't have that spotting happening in a couple months when you get back home. So if you know you're having, say maybe a holiday dinner at in-laws you don't get along with, something like that, take extra progesterone. You'll be calm, collected, and all go better.
Yeah, and it's not going to hurt you. And it's, a lot of people ask me, will this make me gain weight? And I was thinking about you eating your large meal after when you were feeling dizzy. And I thought, well, that's one way that you could gain weight with progesterone, but generally it doesn't. It's anti-inflammatory, it's detoxifying. And it's very calming and
Diuretic. And
Wow.
it helps your thyroid work, which a lot of the problem is our thyroid activity diminishes as we age too. So part of that is because we've lost our progesterone activity.
beautiful. Yeah. So thank you so much for
Oh,
sharing.
it really is my pleasure.
This helps lots of people.
Yeah, I hope so.